Good morning, everyone. Just want to wish everybody a nice day. It seems like the weather has turned a little bit, at least it's cooled off. So today we have a part one of our webinar on long-term care with David Key, who's is part of Double Health USA. And David is a licensed agent and consultant, primarily assisting seniors on Medicare and Medicare plans. Dave has over 55 years of experience in health insurance industry. Dave served as the Blue Cross Blue Shield of Michigan Vice President for the National Chrysler account, where he had a responsibility for the estimated 30,000 Chrysler salaried retirees. He also had responsibility for the UAW retiree program for about 500,000 UAW retirees. Upon his retirement in 2008, Dave formed Double Health USA, dedicated to helping seniors and healthcare issues. Among his clients are approximately 300,000 retirees of the International Association of Machinists and Aerospace Workers and the National Chrysler Retiree Organization. Dave has worked with the NCRO and NCRO members for over 15 years. David has an MBA in insurance and risk from Temple University and an MBA in marketing from Wayne State University, and served as an officer in the U.S. Army. Thank you for your service, David. Today, we will get started in just a second. People keep joining. But for those of you, if you have questions, you'll see a little red arrow or orange arrow in the right side of your screen. If you click that arrow, it'll open up a panel. And in that panel, you can type questions. We will take all questions, hold all questions until the end of today's first part, at which point we'll go through them. And if we don't get through them all, we will contact you directly with answers. So with that, and with our 37 folks that we now have online, I'm going to turn it over to David.
Well, thank you, Dale. Thank you for that. Thank you for that flattering introduction. I'm not sure I quite deserve it, but I appreciate it. Good morning, everyone. I'd like to talk to you about long-term care today. It took a while for me to put this presentation together because I'd put other presentations together, but as I had experience with actually family members and friends and everyone else, I began to realize that long-term care is a very complicated issue, and it's well beyond just insurance issues. It really involves your entire life. So I had to change the presentation to that to reflect that. And just to give you some sense of it, just some of the things that you think about long-term care is that really it affects the whole quality of your entire life for you, your family, when long-term care is needed, and has great consequences for this, for everyone, for your entire family and yourself. There are many decisions which will affect or impact exactly what the strategy is or what you should be doing. Things like where you should live, what your lifestyles. And this presentation that I put together is going to hopefully address these issues. Long-term care, information on that cost, and kind of your options to fund these costs. Although this is geared really to retirees and their spouses, it might be helpful also for any of you who are in the other stage, in the sandwich stage, where you're actually helping your relatives, your dear ones, in their long-term care issues as well. So, well, what is this presentation about? It comes down to maybe four things. First is an overview of what long-term care looks like. You know, what exactly is long-term care? How does it work? What are the services that are provided for long-term care? The second, we get into that a little more than that, saying what are your options for long-term care? Like if you're in need of it or someone is in need of it, what can you do? How can you handle that? What are the programs? What are the means that you're able to deal with this? And then finally get into ways, well, now that you know what long-term care is, You know what some of the options are to deal with long-term care. What are the ways to fund it? And that gets into two things. It looks into government ways, and we'll kind of go through, we'll touch on programs like Medicare, Medicaid, even though I have to say I'm not I have to give a disclaimer saying I'm not a certified Medicare or Medicaid advisor for the government. So what information I have is information as an insurance issue. That's a pretty secure, guaranteed issue. When I get to other things that are not into insurance, it's more of a kind of an informed layman. But I'm going to give you that just because there are a lot of details of things that take you off in different legal and other directions. And then probably the most important thing is once you know what long-term care is, what options you have, and how you think you like to fund it, what are your strategies for this? And it's really important to have a strategy. Probably the worst thing that you can do is to suddenly be confronted with a situation and then begin to scramble. You want to be able to look at these decisions just like you're looking at your retirement in a long view to make sure that you do the best things that are right for you. Well, let's get to the first issue. What does an overview of long-term care look like? It's in question mark. And we'll do that looking at a couple of things. First, a definition, what is long-term care? And we'll go through each of these topics. And secondly, what are your chances of needing long-term care? And there's some interesting numbers, but I think as you'll find, they're not always as precise as we'd like them to be. The third one is how much does long-term care cost? Once you look at the options, whether it's assisted living or living at home, what are the potential costs of these options? And then that will give you an idea of how much money you need to fund possible long-term care costs. Once you know what long-term care is, you know your chances of needing it, and what these items cost, and then you can look at it, how much money that you would need to fund possible long-term care costs. And it's as we get into this, you'll see that it's not precise. No one knows exactly whether they're going to get away with very little cost or a lot of cost. It just depends on just kind of luck of the draw or how things work out. Okay, let's get into the first thing. What is long-term care? Well, long-term care is really kind of precisely defined, and this is defined by insurance companies, by Medicaid, and probably most everybody who looks at long-term care. And it comes down to this, and it's really the inability to do two or more what they call activities of daily living, or ADLs. And these are things that everyone does every day: eating, dressing, bathing, toileting, transferring, and that means getting up from one chair to the other or whatever that might be, and continence. If you have two or more of these issues, activities of daily living that you're not able to do, then you could qualify for long-term care. Now, also another piece that is usually added, but not always, but to most long-term care contracts, and also how Medicaid looks at it, is you have a mental impairment such as Alzheimer's disease, that will automatically qualify you for long-term care. So that's what it really is. You're looking at things, you're looking at the inability to perform at least two of these, or some mental impairment. One thing I want to add with this is that probably another way to look at it as you look at this is you're looking at things long-term care. For most people, this means, okay, this is something that's just not covered by Medicare or Medicare plans from the beneficiary's point of view.
Tammy Barnes.
Oops. So that's kind of what that looks like. So with that, so we so again, these qualifying conditions are important, because without having these conditions or mental impairment, then you're really not in a long-term care situation. What are the types of services that long-term care can provide? Well, there's a bunch of them, and one of them is home health aides. This is that if you're living at home, skilled nursing facility care. If you're out of the hospital and you need care that is beyond what can be done in at home or but not as serious to stay in the hospital. Assisted living. Assisted living is kind of an in between type of service that is, sorry, I guess facility that is not skilled nursing. We don't need you don't need IVs and things like that, but you do need assistance for some of these activities of daily living. And even things like group homes is another alternative that is I'd say more of a family type situation or an extended family, not a real family, I guess not a blood relation family, but their homes in probably every sense of the word with that. And they may have a dozen people, they may have less, or more, but that's another way, alternative of dealing with long-term care. And then you have adult daycare, which probably is, we'll describe all of these things in a little detail. But adult daycare is something where someone could have both, not only just kind of someone watching custodial type care, but also games and things like that to kind of get people kind of engaged. But that's during kind of like working hours. And then finally, you have like nursing home custodial care, and this is when you are when someone really needs to cannot do the activities of daily living, but also needs medical attention at the same time. Well, how much does each of these cost? And one of the benchmarks that I've used are it's a company called Genworth, and they're one of the companies who do long-term care. And every year they go back and look at the cost of these services. And let's say homemaker, the first one, and these are on an annual basis. But if you look at what a homemaker is going to do, if you're unable to do, or whoever is unable to do a lot of these activities of daily living, it's hard to keep up the home. And so these are services, and for the cost, and this is for the national. This is a national survey of costs, and this is for 44 hours a week for really every week. So that's would be $68,000. That's just for homemaking services. Now, home health aides are people who actually will be able to do to help with the activity of daily living, helping people dress, helping people with their continence. That's more expensive, and that's about $75,000 for. But this is for 44 weeks. This is like for every week of the year, and that is 44 hours a week, which would be like 6 hours, a little more than 6 hours a day with this, because you may not need a home health aide there for every moment of the day, unless there's a real serious situation where you need 24-hour care. But that gives you an idea of $75,000. Adult daycare, which you mentioned, which we'll go into more detail. This one is we really are having kind of community service. And that one is $24,000 a year, and it's 5 days a week, because these adult daycare centers usually don't do weekends, and that's for every day of the week, or every week of the year is $24,000. And then you see assisted living, and assisted living is one of these things is not really completely defined, but you can see the cost of assisted living is $64,200. And that's for 12 months, and this is with for a private 1-bedroom, to give you just a sense of assisted living. Now, remember, when it's assisted living, that you're actually moving it from your home to an assisted living quarter. So some of the $64,000 would actually be almost like rent, or what you would be paying just for your daily living expenses, like just for your room and board, basically. But there are also other things that for assisted living that can provide as well. You need some help to do those daily activities of daily living. And nursing home is the most expensive one. And this is, again, nursing home. You're in a person is in a facility. They can't do 2 or more of the activities of daily living. Plus, they need medical attention. They may need IVs, catheters, things like that. That is the most expensive, $116,000 a year. But that just gives you an idea of what these things cost, or what the services are that can help you deal with long-term care. And next, we'll kind of go through and look at all of these things a little deeper. Well, before we do that, what we also want to do is kind of give you just an idea of saying, well, we know how much this costs, but what's the likelihood that you're going to need long-term care? Well, that is a question that really cannot be answered individually. And we'll go through some of the numbers that are behind this. And if you look at this, you'll find that the numbers can be confusing. And as I look through this, and I try to see if there's a real clear, logical way that you could lay out exactly, put all these statistics together and get them to cross-check with each other. And I really found that you really can't with this, because the data, if it's out there, it's not publicly available. Even though someone seems to know, but with this, as they set rates and things, but it's a little confusing. But for the first one is the most commonly used by a lot of people, saying that 70% of people turning 65 will need long-term care. And this is by Health and Human Services, so by the federal government, and everybody kind of uses this. But the thing about this, I mean, it's scary saying, is this, it almost implies saying that you're going to need 70% of people are going to need long-term care. But long-term care, remember, is really some of the services, some of the activities of daily living. The cost for long-term care really comes when you're outside the hospital. So sometimes if you're in the hospital, I mean, if you have a stroke and you're in a hospital, maybe a skilled nursing facility, a lot of those kind of services will be paid for by Medicare, and if your Medicare plan is going to cover most of those costs. So some of those costs, so even though 70% of people may develop some kind of care, and if you think about it, I mean, end of life, almost everyone, a good chunk of people will need that at some point, but they're in that 70% number too. So it's a scary number, but it's I just want to give some context to the number, because it really, sometimes you can get thrown off by exactly what the numbers mean. Well, just some other ones, and these are more like just facts that are thrown out there, and we'll kind of go through these, but I want to point out that that they can be confusing. This is one, and you see Morningstar here as a reference. The reason why Morningstar shows up, because they were one of the few that I could find that documented a lot of what other sources were saying, which were undocumented. At least Morningstar went out and actually documented this. And we'll just give you some of them. It's not important to know these, but just to get an idea of what they look like. And it says the average period of care for men 65 who need long-term care is 2.2 years. Now, this is some people, probably most of you out there, aren't in this category, because you may not need long-term care yet, but if you do, then the average will be 2.2 years. And so it does just all this number does is give you an idea, saying, well, if you're unlucky enough to need it, and if you're at 65, which is different than say 72, when you may, or 78, say, when you may not live longer than 2.2 years, it's a different story. So I just wanted to show you these numbers just to give you an idea, but I wouldn't spend too much time thinking about them, other than saying, well, I guess this, if I do need this and I fall in that category, I might need that. And for women, it's 3.7 years. And another kind of factoid out there, and this is if 20% of the long-term care residents will need care for 5 years or longer. Now, you have to look at this, and again, this is how this is set, because the numbers, the wording can be confusing. But these are people who are residents, and those, for people who are residents in a nursing home or in assisted living, they might require 5 years or longer. So it doesn't again mean that 20% of you will be in here for 5 years. It means for those people who are residents, you can expect 5 years. So what are all these things is telling you, saying that, well, if you need long-term care, you may fall into one of these situations, but doesn't necessarily mean that you will be one of the people who need this. And again, this is again, the 48% of people turning 65 will need some type of paid long-term care services. And that could be true. That probably it means that that's not 70%, but that might be a little more accurate, saying that at some point you may need some services that are not covered by Medicare or Medicaid, and it doesn't say how much they are, but that you may need them. So again, don't take these things. I'll take these as little facts that are out there that are sometimes reference with each other, sometimes they don't. But just to give you maybe a better idea of saying, well, what's the average with this? And again, there's not a definitive way to look at this, But here's some guidelines, and let's take a look at first of average cost. And there have been some things on average cost that are published to give you an idea of that. And one of them, I guess the most research, is something from HHS, and HHS is the Medicare Health and Human Services Department, and they're the ones who basically run Medicare, and they study it, and they look at that, and they did create a model that's saying on average everybody 65 will incur $120,900 in long-term care costs. Well, that's an average. Some will, and any average, as you know, is in the middle. So some will have much less, and some will have much more. And the question is, you know, where do you fall? And also, if you look at averages, if you have somebody's got $1 million of care, that drives up what this average is. So not everyone will hit that, but this gives you at least a basis, saying, well, what's the average cost? This one is $120,000. And just again to give you an idea. Now, another piece, another study that I found that you can really kind of tear into a little bit, is saying that it was done by Price Waterhouse, and the only thing about this one, it's a little old, it's 2017, but they actually took information from insurance companies, long-term care insurance companies, and actually looked at their actual claim data. So when they looked at that for people who file claims, the average cost of long-term care was about $172,000. Again, the average is an average with that. And so if you're on one end of the stick, it might be zero, and the other end could be $1 million. So, but again, it just gives you an idea of what you're looking at, because that's one of the first things you want to consider. Well, some of the specific costs beside averages, just give you an idea of just some of the costs that might be that you might have for like dementia care. And this one is it gives you an idea if you have that with and this is with mostly non-paid, non-family care. The cost is probably somewhere in that $321,000 range, and that's probably accurate. And this includes people who need 1 year of care, people who need 10 years of care. So again, this is an average. But the actual care in the facility is about $195,000. And again, it gives you an idea, but probably the biggest thing to take away from that is that the caring from home is probably the most expensive way of doing this for providing care for somebody with dementia. And well, what does all this mean? And this is I hope I'm not boring you all with these statistics, numbers like that, but I think probably the thing that I found that is the most I guess the most easy way to look at it is by looking at a chart, again, which PwC, this accounting firm who looked at insurance company data, saying, well, what does this mean? And again, this is 2017. What does this mean? Or look at this in kind of intervals. Now, I hope you can read this. But if you look at this, and again, take in consideration where it says, first it says threshold. It says, okay, what's the probability of a claim exceeding $50,000? The probability is 65%. This is based on real data. So that means that you're going to have the probability of having $50,000 is probably where most of these are going to fall. Say $100,000, 52%, and these are actual claims. And then you're getting, because the average is probably going to be somewhere between 52 and 39, close to 52. And you see for $150,000, man, this is like, what's the probability that you're going to have something that exceeds $150,000, and that's 39%. So you can see the average is somewhere between 100 and 150,000, but you get to take these numbers and probably multiply it by at least 30% more to get an idea of what the cost would be in today's terms. But if you look at this, and let's look at the other end of it. If you look at, look at the other end, the $1 million claim, and then that's less than 1%. And if you look at these, well, what about 750,000? You see these numbers are still relatively low what it means is that when you look at an average, the average has all these probabilities of these lower cost amounts, and they're not low. But then when you take a look at the higher cost, you get to the higher cost, much less probability, but much more dollars. So what it means basically is that you're looking at a curve, or you're looking at something saying that, well, on average, you might get away with something. You might be less than $50,000. That's pretty. You got a pretty high probability versus being on the other end, being $1 million or more. Then you're on the higher end. But again, it's a question of saying, well, how much risk do I want to take? Well, I want to say, well, I can probably get by with the average. I don't want to be disrupted. I'm going to go for the most, or I can just skate along with whatever else I have to do this. So this is important, and it's a little mind-numbing looking at all these numbers. I wish there was a neat way to say that yes, this is what you can expect. But I think what you can expect is that you can expect something. If you hit average, you're going to be in that $170,000, $140,000 range. If you're unfortunate enough to have to need a lot more care, then you're going to be it could be in the $1 million range, something like that, depending on exactly how long you live and things like that. But so it's not a smooth bell-shaped curve. It is one that's very much skewed, where most of the costs are really at the high end, but the probability that you're going to need it is low. So I hope that makes some sense. It is confusing, and but I wouldn't get confused by some of the claims that saying 70% of people are going to need long-term care. It's true, but the important thing is, well, what does that mean to you and your estate, your family, and how that works? Okay, well, now we get into kind of what are the options for providing long-term care, and these options are really kind of the following. First thing, you can age in place by staying at home with or without assistance from the family. You can stay at home, but supported by a Medicare program, which we'll describe, which is called the PACE program, which Medicare actually does provide. One time they do provide a lot of services if you're willing to meet the conditions of this kind of plan. We'll go through adult daycare centers, assisted living and memory care facilities, group homes, nursing homes, and then something called continuous progressive care facilities, which we'll describe in a little detail. Now, these are not all mutually exclusive. I mean, it's possible that at some point you might need you might be able to stay at home, and at some point you may need to go to an assisted living facility. But we'll look at these kind of segment by segment, looking at them individually, but knowing that they might be used one on top of the other, or sequentially, or however that might work out. Everybody's a little different. And one thing also, again, to point out, is that the Medicare does pay for some facilities, skilled nursing facilities especially. Skilled nursing facilities is if, let's say you have a stroke and they've stabilized you as much as they can in the hospital. Now you need a lot of intensive physical therapy and you need extra care. So care that is beyond, you still need medical care, but not enough that you need to remain in the hospital. A skilled nursing facility is part of Medicare's benefits. So the first 20 days are free, or Medicare pays for. You may have to have a copay after that, but those are services associated with not being able to perform the activities of daily living, but they will also pay for some of these costs as well. And that's one part where Medicare does pay. So it kind of throws off these numbers a little bit. Okay, what does this mean, aging in place by staying at home with or without family assistance? Well, it basically means you have one or more family members providing activities of daily living, and these are things like toileting, transporting, getting up in the morning, feeding or eating, and that is something a family member may do. And there's usually one primary support giver, sometimes with more family support. Some people can kind of divide up the families, divide up the area, but probably more likely is that you might have some paid caregivers who are providing some of these services. Things that the patient may need help with toileting, getting up in the morning, and a paid caregiver. And there's things called or nurse certified assistants who actually provide some of these care. And that's probably the more typical. A family member might do as much as they can, but they need help. And even paid caregivers might, if a family member is doing most of the help, they might need care for a respite, just because it is a very demanding job to take care of someone who needs long-term care and can't do their activities of daily living. So that's what this looks like. And it's probably probably most people are familiar with this, but just to kind of go over what that looks like. What are the strong points and issues with aging in place and staying at home? Well, it is if the primary caregiver is an unpaid family member, it certainly is the lowest cost. And most people want to stay in their homes. It's up to 88% of people who if they need long-term care, they would prefer to stay in their homes. So that meets the needs of most people. And family relations can be maintained or sometimes strained, but the family is how the family reacts and how the family works together is critical. But that family relationship can be maintained. And then also, if you stay at home, all the existing relationships with doctors, hospitals, and everybody else can remain the same because you're at home. And basically, the thing is you're at home. And also, what also happens is when you look at any assisted living facility or let's take a nursing home, because that's where they have actual very stringent caregiver to patient ratios. If you're let's say you're in a memory care facility, you might have one nurse might have 11 to 20 patients. So your ratio of patients to healthcare givers to patient might be 1 to 11 or 1 to 20. If you're at home, then that is closer to 1 to 1. So it's a strong point. And I know we went through this with my own family, saying, well, so we look at a facility and we looked at that ratio and we said, well, I think we're going to try to do the highest ratio or the best ratio as long as we could. So, and it's different, but it's also a lot of work, and that's probably the issues with this. It is a demanding full-time job to do this. It's very hard, especially if you're still working or doing other things. It may become almost impossible. And you also have to have family members who are willing and able to perform this. And it's not everyone can do this. And if the primary caregivers are paid outside assistance, then it is the most expensive long-term care option. And sometimes you just cannot do things at home. It might get to a point where even though your best intentions are there, it's something that you can't do, especially things like Alzheimer's when you're in memory care and somebody can be wandering around and things like that, where it's just very hard to maintain that. Okay, another thing we want to mention is something called a PACE program that you may not have heard of, and this is something we mentioned, and it's basically a program that provides comprehensive medical social services to seniors at a nursing home level of care. So that means you're getting things like you might be getting IVs, or you might be getting all types of things where but you're able to live at home. And it usually requires probably a good bit of assistance with a family member and those community as well. So this is actually a program that you can have, and it provides the same care provided by Medicare and Medicaid. So whatever Medicare pays for physical therapy, things like that, Medicare pays for. That's part of the PACE program. And but in addition, it provides these social services like the adult daycare, could possibly transportation. Counseling, those services are provided in addition to what Medicare and Medicaid usually pays. And there's usually a team of professionals who coordinate all activities for people and for this. And if for people who are in Medicaid, they may not have to pay anything for this. Maybe if Medicaid will pay the difference for it. But if you do not have Medicaid, then you do have to pay a monthly premium in addition to your Medicare Part B premium. But the PACE program replaces original Medicare and Medicaid. So if you had this program, and if you have, say, original Medicare and a Medicare supplemental plan, that would be replaced by a PACE program. So, and then again, you have to pay the Part B premium, and if you have you may have to pay the drug premium as well for, and then a premium for long-term care services if you're not eligible for Medicaid. Again, the biggest thing about this is that it takes the place of Medicare, and it becomes your version of Medicare for this. These programs are available in Southeast Michigan in many areas, but they are not in every state and every community. But this is something that is overlooked with that. But the biggest thing too about the PACE programs, the strong points is that it combines Medicare and Medicaid to provide a comprehensive base. And it's for Medicaid people, it's Medicaid people, it's actually pretty much free. And sometimes it's used for dementia patients. It's often used for dementia patients. Issues with that is that you have to use the PACE doctors in hospitals only. So if you've been seeing someone seeing a doctor for a long time, those doctors will not be in the network. The PACE program has a very specific network who provide all your care, and they're limited to just specific geographical areas. And again, it replaces Medicare and Medicaid, but it's at least a lot to inform you about this option, because it does a lot of what long-term care does, especially for dementia patients. But there are things that you have to kind of give up with this, or I guess you have to, I would say give up is not the right word, but you have to exchange. There's an exchange of other things that you would have to no longer have, like original Medicare. Adult daycare centers provide a secure center. It's really what these are. What they really are usually community type programs where there may be a lot of seniors, and they provide social interaction, mental stimulation, trying to keep people active, and also meals. So it's something that really is there for someone, especially it's geared for somebody who is caring for someone but has to still work, and that's usually during normal working hours, and it allows caregivers to continue to work. And most adult daycare centers have a nurse on staff to provide some provide medical services such as physical therapy, but most of them it'll vary a lot between these centers. And there are specialized daycare centers for dementia and Alzheimer's. And this could be a way to augment aging in place if you want to stay at home. At least it gives somebody a partial break for this. And it's usually much less expensive. You might recall that the cost of this was something like $22,000 a year, which but it takes over a good third of the waking hours of the day. It probably can't be considered a solution on its own, because they're normally limited to normal working hours, so it can't be a standalone solution. So that's adult daycare. Now, assisted living and memory care facilities is probably what maybe most interested in. But remember, these help with the activities of daily living, such as grooming, bathing, toileting, etc. But also even things like just shopping and other activities as well. Assisted living, I described a little bit about nursing home facilities where you really need medical attention, plus you need help with your activities. You can see staying at home. You're staying at home with this, but you still can do. Probably can't do two of the activities, but you might be able to still manage with assistance. Assisted living falls in between this. It's between the nursing home and staying at home. And these usually assisted living facilities typically have pretty good resources and large staffs, but it's on the lower end of the rung of the ladder as far as medical attention. Medical attention is needed. Sometimes they provide their services a la carte, like saying, okay, well, you're here, but you need to have somebody to help put you to bed at night, and then it might be a cost for that. So sometimes they have this a la carte pricing, and sometimes you usually have it's usually a private or shared room. Of course, the shared room is less expensive. And some of the services that they provide are meals, medical management, and prescription drug management, which is really very useful, because that prescription drug management plays a good part of most people's health, and it's pretty easy to confuse. and everything like laundry and transportation, recreation activities, and you see buses and things like going around. They're probably from assisted living. And there are also memory care facilities that are a form of assisted living that specialize in dementia and Alzheimer's. For those facilities, you need special safety and staff who are geared especially for these for memory care. What are the strengths and possible issues? Well, they provide a comprehensive They provide a comprehensive and safe way to assist seniors who can no longer live independently. And the medical and prescription drug management is really a critical factor. It does provide with a lot of social interactions, probably as much as you'd like. And they are, for the most part, really committed to the dignity and welfare of the residents. So they try to do their best. And of course, it can vary among agencies, but typically, I think they try to do their best. Issues, it's relatively expensive, and only a limited amount of services are covered by Medicare and Medicaid. The biggest cost for assisted living is probably going to be basically your room and board charge, and that is not covered by Medicare or Medicaid. But services for some of the other services like physical therapy, they would be covered. And they may or may not have independent apartments. And you really need to do some research on assisted living to find out before you select a facility. There are some organizations like U.S. News and World Reports, which rates these facilities, especially memory care facilities. So it really does that there can be pretty big differences between these facilities. What are group homes? Group homes are an alternative for assisted living residents who need care and observation. Again, this is really more like a home, that might have 5 people, might have 15 people, but it's a home rather than an institutional setting. And the ratio is probably better, 5 to maybe 1 to 5 or 1 to 20. That's pretty high ratio, but you have a more favorable ratio than you would probably in an assisted living or even nursing home facility. And they typically have certified nurse assistants or connections to nurses for any help they might need. And some of these costs might be covered by Medicaid, even though because they're doing kind of a comprehensive service. They're not treated the same way as assisted living with that. But that kind of depends on the facility and the state. But they're usually less expensive than assisted living. And there are some homes that specialize in patients with dementia and Alzheimer's disease. So that's another alternative out there. And some of the strong points is that it's a home-like family setting, may be covered by Medicaid, better patient to staff ratio, and smaller settings are best with people with mobility issues. I mean, if you have 5 people, it's easier to take in consideration some of these issues. They're not very, they have limited structured activities. With that, privacy can be an issue because that's you don't have many private rooms with that, and compatibility could be an issue. This is like a family setting, and like any family, you may like or dislike your family members or your group home family members, and it can be private pay if the resident does not qualify for Medicaid. But again, this is a less expensive, more more family-like situation. Now we get to nursing homes. Again, they provide 24-hour-a-day skilled nursing facilities, and they're designed for the seriously ill patients who are ill but don't require admission or continued stay in the hospital. And they provide a wide range of services like physical therapy, personal hygiene, social activities. And they provide the most level of intensive care, therefore they're most expensive. And nursing homes may or may not accept Medicaid. A number of them do, but you have to really look at this issue very specifically, especially for a nursing home that you may want to use. Get back there. And assisted living group home members or aging in place members may eventually have to move to a nursing home if a condition becomes too serious to treat at home. Strong points, well, they provide the most comprehensive care. for serious medical conditions, they may be the only option, and a number of them will accept Medicaid. And again, if a long-term care patient is admitted to a hospital, that may be covered by Medicare at skilled nursing facility for at least some period of time. And it's not the most that skilled nursing can be paid for by Medicare. Medicare is 100 days, and it really has to do with treating the medical condition, not so much that they can't do the activities of daily living. Issues with this is that it's by far the most expensive type of long-term care, and most Medicaid doesn't pay for most of this. Medicare doesn't pay for most of it. Skilled nursing will not accept, some nursing homes will not accept Medicaid and require private payment. Let me go through this real quick. Continuous care. What is continuous care? I'm saying I'm running out of time a little bit. Continuous care is provides everything from independent living to assisted living and even nursing home care. And usually they require some kind of upfront payments. You might get that if you have to sell your house because you're really making a commitment to move somewhere. And sometimes they bill separately for payments, and sometimes they're tied to these residents are tied to, but one of the things about like these facilities that once you get in there, especially if you pay a lot of money up front, you need to really look at this facility, because you're depending on this facility to provide care from independent to, if you needed, nursing home care. So you need to look at the financial stability and the community which you're going to really move into. Some of the strong points of this, it's really high quality care, and it goes from independent again to nursing home care if needed. And some of the best senior care facilities are progressive continuum care facilities. They provide certainly a safe environment, and it's specialized memory care facilities are available for that under these continuous care facilities, and it removes the care from the burden of the family. And again, this starts, you're probably, for the most part, you start when you're independent, you don't need the care. And if you do need the care, it progresses along with how your medical condition goes to give you care basically no matter what. These facilities are usually lifetime commitments and not easily reversed. And the conditions in a care facility could change over the course of time. So you need to watch out for that. You typically have to pay a large upfront fee, and this is maybe in the hundreds of thousands of dollars. And if you don't pay for a large upfront fee, sometimes these services will be more ad hoc. Okay, well, we've rushed through this, and that is the first two parts. The first of two of the parts of the long-term care presentation. The next ones that we are going to go through are the possible ways of funding, and I've got to go back here. We've covered, go all the way back with this. I hope you have an idea of what long-term care is and getting a context of what it is means to you with this. But this is really the beginning of the story. I think the takeaways with this is that you don't know exactly how much you're going to need for long-term care, but you're going to be either lucky or you're going to be unlucky. And if you're unlucky, what does that mean? Then we get to the planning part. That's when you need to look at it for your own individual things. But what we've done today is we've got an overview of long-term care, and we looked at the options for long-term care. The next two parts, and I guess it looks like we're going to have to do it the next day, will be the ways that government works to fund these programs, and also private ways, and then what you should consider when developing a long-term care strategy. So Dale, I think that is probably about all we can accomplish for today. I guess we're ready for any questions.
And I've got a couple here, so give me a second to change my screen around. It's probably going to come up, generally comes up wrong. It's the one I want. So you should see my whales at the moment.
Yeah.
And I'll pop this up. So first question, there you go.
No, the question is, in Michigan, do you have to be on Medicaid to receive pay services? No, you do not. But what you would do is you would have more costs if you have Medicaid, it's basically going to pay for all of your costs. You'd have to pay like the Medicare Part B costs. You have to still have your Medicare prescription drug cost plan that you would pay for. And the other services that are provided, like the transportation and things like that, would be an additional cost. So the answer is that you don't have to be on Medicaid, but you will have some additional costs. I understand many long-term care policies, not sure about Chrysler and MetLife, do not pay for the first 6 months. Is that true? Seems like a pretty big drawback. Most policies, a typical, they call it a waiting period or elimination period, is usually 3 months, but that can vary with it. You can, depending on the policy, sometimes you can reduce that to reduce almost immediately, but then it'll be more expensive. But typically, the typical average policy has a 3 month period where you may have to pay for additional services. And for long-term care, and depending on what you're looking at, is that there are things like short-term care, things like that can pay for things like that. But for the most part, one of the things, and we'll get into the planning part of it, you may want to look at this in the long run, saying, okay, well, the first 3 months, or if I pay the first 3 months, here's what it's going to cost. But what will it cost if I'm unfortunate enough to need this for 10 years? What will that look like? But it is usually 3 months, but sometimes you can actually, some policies will get down to even 0, but then it'll cost more. I haven't really gone through the MET program entirely with what Chrysler has, so I'm going to have to defer on that one a little bit because I haven't gone through it in enough detail to give at least my opinion on it. But I do know that the thing I do know, have worked with some of the actually with some of my family on who had a MET policy for another company, and it may be similar to that if it is that same kind of policy. I think there's nothing wrong with that policy. With that, I think it's not more of a question. I guess the question is more of okay, how is the MetLife program shape up, but whether or not that type of policy or that type of program is that the one that best suits your needs. And when we get into that tomorrow, there's pros and cons to this kind of policy. And the policy that MetLife has, basically, at least the one that I saw, which I think is the one that Chrysler has, actually pays for a certain amount of you get a certain amount available each month for this, up to a certain maximum, and it could be 300,000 or whatever it might happen to be, but that would be available for that. And MetLife, I have to say, they're very good as far as again, I'm assuming that you'd have the same kind of service. They're pretty good as far as filing the claim and getting this information out there, but you just have to be sure of what this program looks like, or what long-term care, that type of long-term care policy is, and how it works, and whether it's going to best suit you, and how expensive it might be compared to others. Hospice is hospice. How does hospice fit into all of this? Well, hospice, as you know, is end of life. So it really, at that point for hospice care, you're back in the hospital setting, and so it really is less a long-term care issue than being back in a hospital type situation. It's not a setting, because hospice can be done at home, it could be done in a hospice facility, sometimes it could be done in a hospital. It depends on exactly what you want to have. But again, the rules for hospice are you would follow what Medicare pays for hospice, and they usually don't pay the room and board charges, but they pay for a lot of the other activities for that. So it's almost like hospice is something like, when you get to the kind of end of life, that's where hospice comes in. And long-term care is, you're probably not going to be in a long-term care facility, but you may be, and that's your only possibility. But even if you are, it's the services that they provide for you at the end of life. So with that, it's kind of separate from that. And the hospice could be in a facility, it could be even in a long-term care facility, but it's probably the important thing is it's really for to kind of provide palliative care for the end of life, and they're not trying to treat you for whatever the condition is. They're trying to give you the best final moments that you have.
That's all the questions I have at the moment that have been typed in. Again, we will give you a couple minutes if anybody has any additional questions, but we will be back again tomorrow, same time, 11 a.m. Eastern Standard, to cover the second half of David's presentation. I will do my best to get these videos or the video out for those that may not have been able to attend today. I'm going to see if I can't get it done tonight. It's good to have goals, right? Oops. I have one more question. Put that in here. This one may have to defer to our insurance committee.
Yeah, that one may have to, would probably have to go to the insurance committee, because that's a Chrysler program. I really don't that one I can't really, other than I can comment on it, but as far as applying for that, I think that's one you may have to go to. The insurance committee will certainly know how to apply for and file and have more details than I would about that specific one. But I will go back and kind of look at this to find out what the policy is. But that specific one, I think, would need to be referred back to the insurance committee.
I'll make sure they know about it, and we may cover it tomorrow, depending on how much time we have.
Okay.
Yep, that's all the questions, and I think with that, thank you all for attending. Thank you, David, for taking the time out of your busy schedule. We really appreciate it. And as I said, we will get a copy of the presentation, and the links to the videos will be on the NCRO website probably early next week. But if I get it done sooner, I will pass the link along to the folks that have signed up. So with that, I want to wish everyone a great day, and above all, stay safe.
Thank you, Dale. Thank you very much.
All right. Bye for now.